Also, transforming your face without plastic surgery and starting with, yeah, those guys, the teeth.
Yes, we're in Santa Monica here. I'm Gail Anderson, and I'm going to introduce you to a guy I'm calling the guy who produces the dental facelift. Let me show you what I'm talking about. Here's a patient before he's had treatment. Here's a patient after he's had treatment. Look at that jawline. Well, we're going to introduce you to Dr. Sam Muslin, the high-tech dentist, when we come back. How do you like that sliding door?
Weather may come back, so
It
thanks a
will.
lot, Mark.
It definitely will.
Going to the dentist can actually improve your facial features and appearance.
It's not just about the white chompers in front. Gail Anderson is in Santa Monica to find out how one dentist is actually achieving some pretty dramatic results.
Most amazing. I've had a lot of dental work, okay? I've lived a lot of places, and this is the most amazing doctor I've ever seen. Let me show you a before and after of one of his patients. We're in Santa Monica at the offices of Dr. Sam Muslin. This is one of his patients. This is Vance. Now look at Vance before, chipped tooth, and goodness knows what else is going on in there, and then Vance after. Now I know you're thinking, oh, photos retouched. Here's Vance in the doctor's office. Amazing in person. Let me show you one more thing. Here's another patient of Dr. Muslin's. This is Scott. This is, oh, no, that's what's going on inside there. I wanted to show you what went on inside. The doctor's going to tell us about that in a moment, but you see the before on Vance, after on Vance. Let me give you another example. This is Scott. This young man is okay, but after a treatment by Dr. Muslin here, before, after, his jawline has actually changed, which is why I call Dr. Muslin the dental facelift doctor. How are you able to accomplish this?
Well, for every patient, if you can change their bite, you can actually change the shape of their face. That's the concept I'm trying to basically get across, is that you can change someone's bite, the position of their teeth, and you will change the position of their jaw. And in some instances, you can take 10 or 15 years off of somebody's face. You can make them look a lot younger.
Now, in Vance's case, you had a lot to do here because, Vance, you were not a good boy about dental care.
No, I wasn't. So Dr. Sam had his work cut out for me, but it went extremely smoothly. And I'm very pleased with the way I look, and it was a very easy treatment.
Doctor, what did you have to do? It's more than just a cosmetic issue here.
Well, with Vance, it was a health issue. We had to do some root canals, and we had to do a couple of implants, or one implant, and a little bit of gum surgery. We had to get Vance motivated to do a little bit better, take a little better care of himself, and then we rebuilt his bite and lengthened his face.
Veneers?
We did crowns. Some were veneers, some were crowns.
Oh, we got lots of questions back here,
Go ahead,
Gail.
it's your turn. That's why I heard him and got to it. Go.
Insurance. Does insurance cover this?
Insurance covers to a certain point in 1 year, so most insurance companies will cover $1,000 or $2,000. When you get this level of treatment, you're going to spend a lot more than that.
How much, roughly?
It varies from person to person. If you need root canals, if you need gum surgery, if you need implants, it's more expensive than if you don't need that.
But you're not talking about cracking jaws and moving jaws forward and that kind of thing around, are you?
No, I'm talking about correcting your bite. As you grow older, you wear your teeth down, you've had dentistry, one tooth here, one tooth there, one filling here, one filling there. How about cleaning it all up in one time?
And there's a lot of high-tech business going on here. You hear that beeping in the background? He'll put patients on a heart rate monitor. Vance is on a heart rate. Boy, look, it's going up, 109. There's purified air going on in here. We'll talk more about that next hour. Again, this is why we call him the high-tech dentist. You can learn more about him by going to our website, www.ktla.com. Next hour, we're going to show you another patient and answer more of your questions. It's amazing, the work. When you go to the website, the before and afters are amazing. You can't believe it.
All right, Gailey, thank you so much. Coming up, entertainment news with Sam, a friend's failure.
Also,
I'm Gail Anderson in Santa Monica with Dr. Sam Muslin. He's the high-tech dentist. If you have missing teeth, chipped teeth, or maybe you have the Mark Kriske problem, your teeth are too white, the doctor can fix you up. Details on a live report.
Performing your face without plastic surgery, just your teeth. Hey, Gail?
Yes, I'm at the high-tech offices of Dr. Sam Muslin. Like that door? He can take you from this before to this after. You'll meet him with his patients after we come back.
A trip to the dentist can not only improve your teeth, but maybe even your facial features, your appearance.
Gail Anderson, who's got a great set of chompers herself, is live in Santa Monica to show some pretty dramatic results. What are you doing, love?
Yeah, what are you looking at?
I'm I'm watching you on television.
Oh, there we are. We're embedded.
That's how high tech the doctor's office is here. It makes the patients look up. They forget about biting him. Miracle. We're in the offices of Dr. Sam Muslin here in Santa Monica. One of the little tricks you use so that you can do a lot of things to folks who need a lot of work that looks very natural. Let me show you what we're talking about. Maya's here with us this morning. Look on your left. That's Maya before. That's Maya after. And you just started this work.
That's right. That's Maya 2 days after treatment. We started with her first, her upper 12 teeth, put in temporaries. We're developing her look. We're developing the lip support. We're developing her speech so that we maximize the benefits of her treatment.
And how do you describe Maya's issue?
Maya's issue is that her upper lip needs a little bit more support. Her bite is overclosed, so her face is round. What we want to try to do is lengthen her bite, change the shape of her face, support her upper lip, naturally fill in all the spaces, match the shade of her lower teeth so that I sort of develop a vision for each patient.
So far, so good?
Great. I'm so impressed. Dr. Muslin's been so professional. His entire staff is professional.
I think she likes you, Doc.
I do, because I've been to so many dentists before, and no one has been able to help me. They sent me away immediately and said that it was just too much for them to deal with. So so this was my last chance, my last try. I'm so happy.
Okay. No, I know what that's like. I had something going on like that, but not quite Maya's issues. Another issue we wanted to look at, Vance, we talked with earlier. Let me just show you his before and after. Different issue, chipped teeth, some other things going on there, Doctor?
Yes, chipped teeth. We wanted to lengthen his face, but the primary element of Vance's care was health. And so we wanted to get rid of all the decay, clean him up, lengthen his face, correct his bite, and improve his smile.
All right, now you guys have questions, otherwise I'll show you one more, because the before and afters are amazing. Okay, I'll show you one more. Here is a woman now, she had the state-of-the-art of what dentistry was at the time.
Yes.
She got crowns, whatever, and as she's aged, they've gotten yellow and the teeth, her gums have grown away from the teeth, and look at that.
Well, what we managed to do was to get the gum to grow back between the teeth. When you look at her upper teeth, you can see that the gum filled in all those spaces on the after. So drop down, and then on the lower, we gave her instant braces. We made her lower crooked teeth look perfectly straight in 2 weeks.
Instant braces?
I call it instant braces. Your teeth can look perfectly straight, and they can be white. You notice when you look at the lower after that the shapes of her teeth are entirely different, and we got the gum to grow back up in between her teeth on the lower.
Unbelievable. I'm sorry, Michaela, were you going to say something?
That's Mark.
Do you graft gum, or do you actually, treat it so it actually starts growing, or do you have to graft?
Great question. Did not graft the gum at all. I find that when you get the shape of the crown right and your margins are absolutely perfect, the gum will sense that that area is healthy and it'll grow right back up into that space.
Wow.
And so no grafting, no surgery, just basically good crown shape.
I think I need you, Doc.
Yeah, so many questions, but Gail, can you put up some numbers so that they can get in touch?
Sure.
Because we gotta get out of
Everybody
here.
I know. We're going to come back. You can go to our website, ktla.com. His address, his phone number, and his website are on there. Amazing before and afters. Thank you all so much for coming, because they say they don't even recognize.
We appreciate it, Gail. All right, still ahead, Sam's got entertainment news.